My name is granger-bell, and for my project, I'm doing the submental vortex skull. On this occasion, the patient was transported to the imaging room via wheelchair by the hospital staff from the emergency room. I greeted the patient upon his arrival and I asked him where was the trouble in his body coming from. He replied that all of the pain that was coming from his head and that he was told he was in need of an X-ray. The IR size for this examination is going to be 10 by 12. The IR orientation is portrait with a grid. The IR location is the table or wall bucky. The SID, 40 inches. The patient position, supine or upright. Part position, raise the patient's chin and hyperextend the neck if possible until the IOML is parallel to the IR. If supine, rest the patient's head on the vortex, align the MSP perpendicular to the midline of the grid of the table IR. Avoid tilt or rotation. The CR location, erect perpendicular to the IOML. Supine IOML parallel to the IR and perpendicular to the CR. 1.5 inches inferior to the mandible symphysis or midway between the gunions. The angulation for this examination is 30 degrees cephalic. I collimated the beam on all four sides to get the anatomy of interest. I placed the marker on the right side of the grid. The instructions for the patient for this exposure is suspended respiration. The anatomy demonstrated was a foramen ovale, spinosum, sphenoid and posterior ethmoid sinuses, mastoid process, petrous ridges, hard palate, foramen magnum, and the occipital bone. The items in profile are the zygomatic process and the teeth. The pathology for this examination is any external or internal fractures of the skull. The end.